Endodontic treatment of tooth number 8. This 10-year-old patient traumatized her tooth number 8. And as you can see, there's a pulp exposure right there. Look how far coronally the pulp horn extends. So when she traumatized the tooth and cracked the tooth, there was pulp exposure right there. She had all the signs and symptoms of irreversible pulpitis. So today went ahead and sedated her and did the root canal. Look at the apical diameter. The apical diameter was 70 plus. So we were ready for an MTA plug. So let's go ahead and take a look, and I'll show you how I did this root canal, MTA plug and all in one appointment. All in one appointment. Goes.
What is that?
That's the nerve.
Looks like a snake.
Yeah. So the apical diameter of this tooth is very large, but I'm not afraid to use hypo. This is 6% hypo, and I'm not afraid to use it. You know why? Because I know how to use it. I know how to use it properly. I'm a chef who knows how to use his knife, sharp knife properly. So same thing with this. Full strength hypo. I'm not afraid to use it just because this tooth has an open apex. I'm gonna still use it. Thank you. I'm gonna gauge the apical diameter. So this is a 60 file. My working length is 24 and a half. So I'm gonna gauge the apical diameter to see. See, I'm going to 60 is too wide, so the apical diameter is even more than 60, because 60 goes to working length easy, and there's no binding, there's no apical binding of the file to the apical terminus of the tooth. So let me have a 70 dose. Let's try a 70 file now. The 70 file now, stainless steel K file. Okay, let's try the 70. Okay, 70 goes to length and it's binding. Excellent. So now I'm going to use the 70 file to condense the MTA. I mean, you can't really condense the MTA, but I'm using the word. I'm going to push the MTA to where it's supposed to go. All right. Micro suction to get rid of the hypo, and then we're going to dry the canal with sterile paper points. Excellent, very good, thank you. MTA carrier by Vista, and I like the green. All right. So I usually put 2 or 3 loads in the canal before I use my file to push the MTA to the apical terminus. All right, the 70 file now. I push the MTA, the 3 loads that I put in, I push that to about 0.5 millimeter of my working length. I don't push it all the way to working length, because if I push it all the way to working length, I'm just extruding the MTA right out of the canal. It doesn't matter if that happens, but I just, I want to have some control. Another load of MTA, and then I'm gonna use a load of calcium hydroxide powder. Calcium hydroxide powder. All right, so as you can see, now I filled the apical few millimeters with MTA already, so you can see that my file doesn't go to 24 millimeters anymore. As you can see right there, I got good resistance. Final load of MTA, and then we're going to do one load of calcium hydroxide, and then we're going to fill the rest of the canal with GP and sealer. I placed the load of calcium hydroxide powder, and I'm going to push it to where it wants to go. Right now what I'm doing is that I'm brushing the canal walls and just pushing the MTA that's collected on the walls of the canal, using that MTA to also gain length over the existing MTA. So right now, if you take a look here, you can see that I have maybe 6-7 millimeters of plug, MTA plug right now. So if you give me my ring, please. Let me show you. So right now I have 18. Right now it's at 18. My working length was 24. So I have 6 millimeters of MTA plug, which is perfect. Right there. I'm gonna use a large sterile paper point now. I'm gonna wick out if there is moisture on the coronal surface of the MTA calcium interface, just like that, and condense the MTA calcium. Very good. I'm gonna fill the rest of the canal with gutta percha. There we go. I'm gonna let this sit on top of the MTA. This is warm, so I wanna heat up the canal walls so my gutta percha can flow better, can mold better to the canal walls. And now I'm just gonna backfill the rest of the canal with gutta percha. ISO, just clean up the extra cement, sealer. Sterile sponge goes in with a little, all right, very good. Almost done. That's term. It's a dual cure temporary filling. Just like that.
Lydia, you ought to be in pictures. How about cinematography, Lydia? Anyway.
You have any last words, Doctor?
Last words. Be excellent, be meticulous, be obsessive compulsive. It's good for your patients. And here it is. As you can see, everything went beautifully. That's MTA, white MTA right there. And this is gutta percha and sealer. We temporized the tooth and referred the patient back to her dentist. Mom just told me that her daughter, the patient, has an appointment with her dentist tomorrow morning. So she's going to her dentist tomorrow morning, and the dentist will make this tooth look nice aesthetically for the patient. But as you can see,